Good afternoon, everyone. My name is Tarnika Manning, and I'm with the Metropolitan Chicago Breast Cancer Task Force, where we work to reduce breast cancer mortality rates for women of color. And to learn more about what we do at the Metropolitan Chicago Breast Cancer Task Force, please look at our website, which is chicagobreastcancer.org, or give us a call at 312-942-3368. You're watching a live call-in television program brought to you on cable channel CanTV 21, and we are online at cantv.org/live. During our show, we discuss various breast cancer issues that affect women of color. I invite you to call if you have any questions during our show today. The number to call is 312-738-1060. Our phone lines are open. Today, our guest is Roxanne Dakers. Roxanne is a research specialist at the University of Illinois, Chicago, for a great initiative called Moving Forward. She's going to tell us all about Moving Forward and how to get involved. If you have any questions during our talk here today, give us a call at 312-738-1060. Good afternoon, Roxanne.
Good afternoon. Thank you for having me.
Oh, no problem. How about you tell us a little bit about yourself and your background?
I'll go back a little bit. I am a graduate from Kenwood Academy
All
and
right,
a two-time graduate from Tennessee State University.
Oh, okay.
So I received my bachelor's in health sciences with a concentration in public health, as well as my master's in public health with a concentration in cultural competency.
Oh, great.
And so my passion is health promotion and disease prevention.
Oh, great. Very close to what we do at the task force. So great to have you here today. So how did you become affiliated with UIC?
Well, because of my passion, that led me to UIC moving forward because of disease prevention and health promotion. And so I applied for the position called Health Information Specialist. And so my duty is to develop a recruitment strategy for moving forward, as well as to collect data.
Awesome. So what is Moving Forward?
Moving Forward is a lifestyle program. So we are a community-based program in the neighborhoods tailored for African American breast cancer survivors. So it is designed for and with the help of breast cancer survivors. And it's for ladies who want to lose weight, and we have two different groups, which is a self-guided group and a guided group.
Okay. All right. So how and why did Moving Forward get started?
There is we need to have an increase in African American research in terms of breast cancer awareness in our culture. So with that, Moving Forward came about by Dr. Melinda Stolly, who is a clinical psychologist by trade and also a personal trainer. And so she took the two, and Moving Forward was born.
Okay, good. So it's for women who've already had breast cancer in the past, or?
Yes, it's only for breast cancer survivors.
Okay, great. So what are the main goals for Moving Forward?
So we want to see if a community-based weight loss program can help women lose weight through diet and exercise, and in turn, how that weight loss can improve their quality of life and their overall health.
Okay.
And improve their fatigue levels as well.
Okay. So what would the participants learn with their involvement with Moving Forward?
They will learn lifestyle materials that they can take way beyond the program, such as how to read labels, food labels, how to count calories, as well as how to mindfully eat so they don't overeat, and how to prevent relapses, as well as how to properly exercise.
Oh, so relapses with cancer?
Relapses with food.
Okay.
Yeah.
So learning all new eating habits, all new exercising habits. Okay, gotcha.
Right.
And how does this affect their cancer diagnosis or their remission?
Physical activity is known to help reduce the reoccurrence rate in breast cancer patients, as well as to increase their survival rates.
Oh, great. All right. So again, if you have any questions for Roxanne, give us a call. We're at 312-738-1060. And definitely call us if you have any questions. If you know anyone that might be interested in this program, give us a call. All right. So one of the major components to Moving Forward is getting women to become physically active. Why is that so important for cancer patients?
It's important for cancer patients because it diminishes or helps reduce the occurrence of breast cancer reoccurrence, and as well as eliminates a lot of the comorbid conditions such as high blood pressure, high cholesterol, low fatigue levels.
Yeah, good. We actually have a volunteer in our office who is an avid runner, but she's also a breast cancer survivor, and she always talks about how running kind of distracts her from the effects of breast cancer. And she did the running while she was doing the treatment, and she just does it because it keeps her focused and keeps her mind off of all the negative things that come along with breast cancer and the thoughts people have about breast cancer. So she uses running as a way to discourage some of those negative thoughts. So that's another great thing.
I think, and most importantly, it increases the survival rates of breast cancer patients.
Great. All right. So what neighborhoods is moving forward available?
We have been to Roseland, we have been to Woodlawn, Austin, South Shore, and we are currently in Inglewood as well as Calumet Heights.
Okay.
And so we have 2 more groups to go, and hopefully we'll be back on the west side and on the southwest side of Chicago.
Okay. So why were the neighborhoods that you selected chosen?
Breast cancer is a reportable disease, and so with the information we get from the statisticians who populate those that information, the ladies in the neighborhoods that we are in, those are high risk areas for breast cancer, breast cancer rates.
Yes, those are some of the neighborhoods that we work on with the task force. So we definitely do a lot of awareness activities, education in those neighborhoods. So we definitely want to focus in on those neighborhoods that need us. So we all are doing the same thing in those neighborhoods. So definitely come out and call us if you have any questions, if you live in those neighborhoods and you want to learn more. We're at 312-738-1060. All right, so who is eligible for signing up for Moving Forward?
You have to self-identify as an African American woman. You have to be a breast cancer survivor at least 6 months out of treatment. You have to have either stage 1, 2, or 3 breast cancer, and you have to agree to be randomly selected to one of 2 groups. And you have to be overweight. You have to have a BMI of over 24.
Okay. All right. So if someone lives close to those neighborhoods, like on the border, are there any?
As long as ladies are able to commit to the program, they can enroll in Moving Forward if it's easily accessible to you.
Okay.
So you don't have to be specifically inside of Inglewood or Calumet Heights, but if it's easy for you to get to, then you are more than welcome to join Moving Forward.
Okay, good. Great. All right, so what are some of the incentives for people to participate in Moving Forward?
So time is very important to everybody. So we appreciate time and effort. And so we do have a small monetary incentive that we give to ladies, as well as a 1-year free Chicago Park District membership of, a lady's choice.
They have some really nice equipment now at the Park District now. They're really nice fitness centers, so that's a great incentive.
It is.
All right, I think we have a call. Caller?
Hello?
Hi, caller. You're on the air.
Hi, how are you?
Good, and yourself?
I'm good. I have a couple of questions.
Okay.
And I know you're talking about moving forward, and it's geared toward women that already have breast cancer. I have 2 questions. One is, what is exemplified as a high-risk breast cancer area, and where is it that you can get tested for free for breast cancer?
I think you can answer the first question. Do you want to answer the first question?
I'm sorry, what was the first question?
She wanted to know what is considered, I think she was talking about the neighborhoods that you chose. She wanted to know why those areas were considered high risk.
Well, because breast cancer is a reportable disease, that information is populated. So we know that Inglewood and Roseland are high concentrated areas for breast cancer survivors because of the numbers. And so that's why we come into those areas.
Okay. And at the task force, we do provide free mammograms. So if you have any questions about getting a free mammogram, call the number on the screen, which is 312-942-3368. And we can try to get you set up with a free mammogram at a hospital or facility that's close to you. And also, just so you know, those neighborhoods that you chose have very high mortality rates, and so those areas are increasing the disparity rates within Chicago. And that's one of the things that we are working to reduce with the Breast Cancer Task Force. So, very good question. Thank
As
you
well
for
as the limited access.
Yes, yes. So that's why we have organizations that we all work together to try to reduce those rates. So, very good question. All right, I think we have another caller. Caller? Hello.
Hello.
Hi.
Hi. This is Ola Brown.
Hi, Ella Brown.
Hi, Miss Ola.
Ola Brown.
How are you?
Yes, I have a comment for Roxanne.
Okay.
I'm here, Miss Ola.
Hey, Roxanne, I'm with Moving Forward.
Oh, you're a participant.
Roxanne, I'm with Moving Forward.
Turn the
Yes,
TV down, Miss
I
Ola.
graduated in February.
Oh, very good. Can you please turn your TV down? We can hear a little bit of your TV in the background.
All right.
Miss Ola is a wonderful lady. She actually enrolled, I forgot which cohort, but she did graduate in February for Moving Forward. You still there, Miss Ola?
Yeah, I'm still here.
Okay.
All right, Ms. Ola, you want to share anything about your experience moving forward?
It was life-ending. I'm very glad that I was with Moving Forward.
Oh, awesome, awesome. What are some of the things that you gained from participating in moving forward?
Pardon me. Actually, I did an exercise twice a week at Washington Park
Oh, okay, good.
with Mona, Melinda, and Cindy, our instructor. I lost weight.
Oh, great.
I learned to read labels, count calories. They gave us all kind of support.
And you're still doing that, correct?
Not right now. I graduated, so I have a gold card at Washington Park. I can do the fitness center until August 2015.
Oh, good, good. So you got a little while.
Mm-hmm.
That's good. And you're still taking advantage of all the great incentives.
Yes, I am. And moving forward actually helped me. I have PAD. And my vascular surgeon told me one of my vessels out of 4 had improved because of moving forward exercise program.
Yes. I think what's most important for Miss Ola is that she had all those symptoms, but she was still able to exercise because the exercise was modified by our fitness expert, Sydney.
Thank you for calling.
Thank you, Miss Ola.
All right. If you have any questions, give us a call. We're at 312-738-1060. Again, you can learn how you can get involved and be like Miss Ola and have great outcomes and just be a healthier person afterwards. All right. All right. I think we have another caller. Caller, you're on the air.
Hi, Roxanne. This is Barbara. How are you?
I'm good. Hi, Miss Eccles. How are you?
I'm fine. I just wanted to call and just give a testament regarding the wonderful program that you guys offer to all breast cancer survivors.
Miss Barbara, can you turn your television down?
Oh, sure.
Okay.
It was a fantastic program. I lost between 25 to 30 pounds.
Oh,
Thankfully,
wow. That's
I've been
huge.
able to
She
keep
lost
it
a lot of
off.
weight. Yeah.
Ran in a couple of 5K races.
Wow, that's amazing.
It's really a life-changing experience, and I would recommend to any person that has, that has had breast cancer or going through it to participate in this program.
That is awesome. Thank you for calling.
Thank
That was
you,
a
Miss
great,
Barbara.
great testimony. All right, I think we have another caller. Caller, you're on the air?
Hi, Roxanne. This is fabulous.
Hey, Miss Esther. How are you?
I am doing fantastic today. I just wanted to let your audience know that moving forward is a great benefit. When I went through, my diabetes had returned, and through the program, my sugar levels went down drastically so that I'm no longer on insulin.
Oh, wow. That's
And
great.
my blood pressure came down also, and I am pleased with my weight so far in the weight loss.
All right. All right.
Thank you, Miss Esther.
Thank you so much for calling.
You're more than welcome.
Thank you.
All right. Bye-bye.
I think one of the benefits that we didn't talk about is that it helps with other diseases, the chronic diseases. And like we talked, she said PDA, she has PDA and diabetes. All those things have diminished because of their activity with moving forward.
Right.
So,
Lower blood pressure, lower cholesterol. lower blood sugar rates. You know, those are just some of the few things that can be eliminated through diet and exercise.
Yes, like I said, this is obviously a very good program, but if you have any questions, feel free to call us. We're at 312-738-1060, and you can talk to Miss Roxanne here, who's very popular with her participants and moving forward. And we love that you guys have called and give great testimonies and supporting the Moving Forward program, because obviously it's a great program. So again, thanks for calling, and please call if you have any questions or any other comments. All right. So how much of a time commitment is it to participate in Moving Forward?
We ask ladies to commit a total of 1 year, 6 months for the program itself, and 6 months for the maintenance stage.
Okay.
In terms of the self-guided group and the guided group, if a lady is in the self-guided group, we ask that they commit 2 days out of the week, 2 hours one day and an hour another day for the nutritional and classroom setting, as attendance is very important in our program.
Okay. Can you talk a little bit about the difference between self-guided and guided cohort?
So let's start with the guided group. The guided group, once enrolled and moving forward, you'll be randomized to one of two groups. So the guided group, those are the ladies that will be selected to come to whatever park district that we are twice a week, 2 hours one day, an hour for another day, for the educational, nutritional component and for the fitness component. And they will also receive their free Chicago Park District membership. The guided group, they get the exact same information as the other group, except they don't have to meet with us at the Chicago Park District. They tailor the program around their own needs. So those are the two different groups.
So the self-guide is a little bit more flexible, but less structured, I guess?
It's less structured because they're not meeting with us.
Okay.
Yeah.
Okay, good.
So it's the same information, same classroom information, except you get everything at one time, unlike the other group where everything is divided by week.
Okay. I think we've already talked a little bit about your partnership with the Chicago Park District. Who are some of your other partners?
Well, the Chicago Park District is our main membership.
Oh, okay. All right, good. So what parks are you at?
We are currently in Inglewood, and we are currently in Calumet Heights.
Okay. All right, so these are all like different parks within those, or just particular parks?
The park we are at Owens Park, and we are currently at Lindblom Park in Inglewood.
All right, so if you live near those parks, you need to be calling and ask some questions. We're at 312-738-1060. All right. Do you have any early success stories from past or current groups? Because I know you have a lot of testimonies, but are there some that you want to share?
Hopefully more ladies will call in, but our ladies definitely work hard in order to achieve whatever goals that they are trying to work towards. And so ladies lose a significant amount of weight, depending on whatever their goal is.
Oh, okay. All right, so how long will Moving Forward be available? Because I know it is kind of a research study initiative, but so those things kind of fade away with funding.
Yeah.
So
we have 2 more groups to go, so 2 more communities. So we should be starting our next group in the early fall, as well as early spring.
Okay, so if people are interested, they can sign up now for the fall.
Yes, they can definitely call and sign up right now.
Okay, and you probably can call and sign someone up that you know. So.
Exactly. We do take referrals.
So feel free to call and ask questions if you know someone that might be interested. All right. All right, so how do you plan to use all the data that you collect from this program?
The information that is collected through our evaluation tools, which is the interview, the body scan, and the blood draw, will be all populated, and in turn it will be Dr. Solly will write a journal, and just talk about the different findings, whether the self-guided group or the guided group is more beneficial for breast cancer survivors.
So do you think any of this information will be given back to the community?
Yes, our ladies are always welcome to receive this information, and with the hopefully the Dr. Solly's journal will get published, and so it'll be broadcasted on a national level.
Hopefully it can be replicated in other needs.
Right. Hopefully it can be replicated.
Other areas across the country. Yeah, that'd be great. That happens a lot with research studies.
Yeah.
So. And it seems that you guys have been very successful, so that's a great thing to look forward to, getting research published and getting it out there. And then hopefully some of your ladies that called in to give testimonies, can be ambassadors for this after moving forward.
I'm sure they would be glad to be ambassadors for the program.
Again, we're getting close to the end of the show, but if you have any questions, feel free to give us a call. We're at 312-738-1060, and we definitely would love any more comments or questions. All right, so we've talked a lot about the actual program, but how can someone sign up for Moving Forward?
We have a hotline number, which is the best way to get in contact with either myself or my team member, Lauren Matthews. And that number is 312-996-6880. Once again, that number is 312-996-6880. And that is the Moving Forward hotline. And more than likely, you will speak to my team member, Lauren Matthews.
And you'll get a chance to talk to Roxanne, who's very popular with the Moving Forward program. So definitely give them a call. Give that number one more time so that they make sure they write it down completely.
312-996-6880. And you can also look us up on YouTube, UIC Moving Forward, if you want to see us in action. We have a Facebook page, which is UIC Moving Forward, as well as a Twitter page. And our handle is UIC Moving, the number 4 and word.
Okay. That's the Twitter handle.
That's our Twitter handle.
Okay, give that one more time. So
UIC Moving, the number 4 word.
Great.
WARD.
All right, so you can follow them. So even if you don't want to sign up or can't sign up because you're not eligible, you can also follow them on Twitter to see all the great things they're doing and how they're moving forward. So, all right, so again, you said you have a Facebook page. Do you have a website or somewhere people can get more information?
You can always reach us at movingforward@uic.edu or movingforward@uic.gmail.com.
Okay.
But the best way to get in contact with us is through our hotline number, which is 312-996-6880.
Okay. Great. All right. If you know anyone that is a breast cancer survivor and is a little overweight, definitely you should give them a little nudge and tell them to get involved with Moving Forward because it's a great program for them. And I'm sure this is a great program for women to share their stories and of survivorship and how to move forward past the breast cancer diagnosis. So, yeah, I think it's a great program. So definitely go ahead and call the hotline so you can get involved. All right, we have just 2 more minutes, but if you have a last-minute question, we're at 312-738-1060. All right, Roxanne, we are getting very, very close to the end of the show. What else should the audience know before we shut it down?
We, with the research that we are conducting, it not only helps the ladies in our program, but it helps ladies coming out of treatment as well. So it'll help ladies that we will never get to meet and never get to see with the data that we collect in our program. And we are also very actively recruiting. So if you know anyone that is a breast cancer survivor, a mother, a daughter, a cousin, an aunt, a church member, just please give them our information. 312-996-6880.
Okay, great. All right. We have just a couple more minutes left. Again, we want to thank you for coming on and talking about Moving Forward. It seems to be an awesome program. Are you guys going to be doing any outreach anytime soon for people?
We are always doing outreach. We any organization, we are always willing to do presentations, drop off materials to clinics, hospitals, wherever we can get our hands on ladies so that we can help them with this program. We are actively ready to go.
Oh, great. So even if you are not necessarily interested in signing up for Moving Forward, but if you have a church, an organization that you want Roxanne or her colleagues to come out and talk, definitely call that hotline number and you can get involved in getting other people involved. All right. So again, thank you so much for coming out. This has been an awesome show. Thank you all who called in. Thank you for participating in our show. Again, if you would like more information about what we talked about today on the show, give us a call at our offices at 312-942-3368 or give us come visit us on our website, which is chicagobreastcancer.org. I want to thank you all for watching, and please tune in next month where we'll be back on CanTV 21 or online at www.cantv.org/live on Tuesdays. Again, the third Tuesday, we'll be back at 5 p.m. to hear the latest information around breast cancer and other related issues in Chicago. Again, my name is Tarnika Manning, where I'm the Community Outreach Manager for the Metropolitan Chicago Breast Cancer Task Force, and thank you again for watching.
Bye.